When we go on Medicare, we have two big choices to make. Number one, what kind of a plan are we going to have? And number two, what company are we going to choose? And so in this video, we're going to talk about the different plan options you have, and we're going to look at two specific companies. We got a lot of questions today about Cigna as well as Humana, and so we're going to compare those companies and the plans that they offer. There are two different insurance systems available to us within Medicare. The first one would be to make the decision to stay in traditional Medicare, which is A and B, which means A and B pays first, and then we get a supplemental plan to fill in the financial gaps that Medicare is going to say we're responsible for. So that's one system. The second system is to enroll in Medicare A and B, but instead of being under the traditional Medicare umbrella and their direction and their criteria, what we're going to do is we're going to go to a private health insurance company, and they're actually going to replace a traditional Medicare with an Advantage plan. Those are also called C plans. So these are two insurance systems. About half of all people go with Advantage and half go with supplemental plans. All right, now what we're going to do in this video is we're going to talk about just two companies. Now I do want to clarify this, that we as a company are brokers. We write for multiple companies in all 50 states as well as DC. But we get a lot of questions about Cigna as well as Humana, and so we thought we'd take this time just to compare these two companies, again knowing there's other choices, but I think these would be very profitable for you to look at and to make a comparison. So we're going to look at Cigna and we're going to look at Humana in this video. So let's do this. Let's start with talking about supplemental plans. Now, when we have these two systems, I think it's very important to note that the differences between supplemental plans and Advantage plans, there are several, but I just want to kind of highlight the key differences. One key difference between Supps and Advantage is networks. If you're on an Advantage plan, you're going to be either in an HMO plan or a PPO plan. If we're on a supplemental plan, we're following Medicare, which doesn't have a network. Traditional Medicare allows you to go to any provider, any hospital, any doctor, as long as they take Medicare. So that definitely is the difference when it comes to those plans. Secondly, when it comes to the use of the plans, within supplemental plans, we never have what is called a pre-authorization. What I mean by that is that if you're in traditional Medicare and you have a supplemental plan, it is Medicare and your doctor that are really making all the decisions. There's no insurance company interference. They can't intervene. If Medicare pays, the insurance company, that supplemental plan has to follow based upon the letter that you buy. Now, if we have an Advantage plan, there will be pre-authorizations, not on all services, but on about 70% of the services. What happens, doctor makes a recommendation for a CAT scan or an MRI or for some type of surgery, a knee replacement or a hip replacement, and they make the recommendation, but the insurance company has to agree with that recommendation and approve it so that then they're responsible to pay for it. If they don't agree and don't approve, then you're not going to get that particular procedure. And so the difference is pre-authorization. So supplemental plans never have them. Advantage plans are going to have them, about 70% of the services that we need. The third difference would be the way we pay for them. If I'm on an Advantage plan, the only thing I have to do is be enrolled in A and B. I pay my B premium, and usually there's no premium attached to the Advantage plan. In fact, 2 out of every 3 Advantage plans today have a 0 premium. Why no premium? Well, because instead of paying a premium, what we're going to do is we're going to pay as we go. And you'll see that in this video today, but we pay co-pays for certain services. All right, that's the Advantage system. Now, when it comes to supplemental plans, we always have a premium. Not only am I going to pay my Medicare B premium, but there's going to be a premium, pretty reasonable premium, for the supplemental plan. So for me to get rid of the financial liability that exists within Medicare and transfer that liability to an insurance company, I'm going to have to pay that insurance company a premium to take that liability from me. Okay, so that's the way we pay. So supplemental plans, we pay a premium, we pay A and B or B, and then after that we have very little out of pocket. Advantage, we pay A and B. Again, A is usually 0, but B has a premium, but the insurance company typically no premium because I'm going to pay as I go. And again, we'll look at those today. So the issue is that those are the things that you have to realize. These are different ways in which these insurance systems work. Okay, now what I'm going to do now is I'm going to start by talking about the supplemental plans. We're enrolled in Medicare A and B. Again, A is usually zero premium. B has that premium. So now we're going to look at the two top plans. So of all the people today that are buying supplemental plans, 70% are getting Plan Gs and 30% are actually buying Plan Ns. They're both wonderful options, okay? So let's talk about the supplemental Plan G. So as you can see here on my screen, this represents what we refer to as original Medicare, traditional Medicare. And as you can see that there's Part A, which is hospital and inpatient and skilled nursing. Part B is going to be everything outpatient as well as all doctor services. And so with each of these parts of Medicare, we have three gaps. You can see them on the screen. Part A has a deductible. That deductible this year is $1,632. That's all you have to pay to go to the hospital for up to a 60-day stay. Medicare covers everything else. Now, one issue about that deductible is it's not annual. It can happen multiple times in a year. It's called a benefit period deductible. And if I'm ever in the hospital and then discharged, and if I'm then out of the hospital 60 days or longer and I have to go back later, then I would pay that deductible again. But if I'm discharged from the hospital and within 60 days I'm rehospitalized, I would not have to pay that deductible again. That's the difference. So that's all we have to pay out of pocket, the deductible $1,632. Then you'll see the next gap. We call these extended hospital stays. Frankly, they're very rare, but when they occur, as you can see, they're expensive. Month 3 in the hospital, this would be the third consecutive month, we would have to pay a daily copay of $408. Month 4 and month 5, we'd pay a daily copay of $816. So you'd be responsible for that out of pocket. The last item here is called skilled nursing facility. Now here's the rules. Medicare says you must be in the hospital a minimum of 72 hours or longer before you go to skilled nursing. But if you have been in the hospital 72 hours or longer, Medicare says they'll cover everything the first 20 days. Doesn't cost you a penny. After that, if you're still in skilled nursing, which is the norm, the next 80 days you're covered by Medicare, but you're responsible for a daily copay of $204. They say right now the average is about 35 to 40 days in skilled nursing for someone that's on Medicare. So that's the A gaps. Let's talk about the B gaps real quickly. The B gap begins with the deductible. It is not like the A gap. It only happens once a calendar year, and that deductible this year in 2024 is $240. So you're responsible for the first $240 of anything on the B side. Now the main thing on B is everything outpatient and all doctor services. Whether you receive those doctor services in a doc's office or a doctor sees you in the hospital, it's the B that's always going to pay the physicians, the surgeons, the anesthesiologists, the primary care docs, the specialists, the ER doctors, the hospitalists. All those are paid through Medicare Part B. So we have to pay the first $240, and then that B deductible resets every January, and then we got to pay it again. So after we've met that small deductible once in a calendar year, now what's happening is we're responsible for 20% of the bill. So as long as I'm seeing a Medicare provider and I'm having a service, a surgery, lab work, or seeing a doctor, but any service that Medicare is going to cover, Medicare will pay 80% of the bill. I'm responsible for 20%. We call that coinsurance. The last gap on the B side is called excess. Now, first off, I want you to know that excess is pretty rare today. About 5% or less of the doctors that receive Medicare patients will charge excess. And again, about 5% or so. But this means that this is a doctor that can bill Medicare, can see Medicare patients, but they do not agree under a contract to accept Medicare reimbursement rates as payment in full. So what do? What they do is they add to the bill. And in this instance, they're going to add 15% to the bill. And when they do that, you as the Medicare beneficiary are responsible for that out-of-pocket expense called excess. And so here's what I'm trying to teach you. These are the gaps in original Medicare A and B. There's 3 on the A and there's 3 on the B. You're fully responsible for these unless you get a supplemental plan and transfer these gaps or some of these gaps to an insurance company and pay that company a premium. And I'll show you those premiums here in just a second. So when someone gets a supplemental plan G, what they're doing, as you can see on the screen now, they're transferring 5 of the 6 gaps to that insurance company. Now that insurance company is responsible to cover these gaps. The only thing you'd be responsible for is to pay the G premium, and then you would be responsible once a year to meet whatever the B deductible is. So that, again, that's the top plan today. Now, the second most popular plan is the N plan. You can see on your screen, again, we see the same existing 6 gaps. Those gaps are 3 on the A and 3 on the B. And if we have an N plan, what's going to happen is it's going to cover 4 of the 6 gaps. G, you just saw, covered 5. N covers 4. So N will not cover the B deductible like the G did not. And N will not cover, and here's one of the differences, it will not cover excess charges if and when they occur. Again, very rare, but if you had them and you're on the N plan, you would be responsible to pay that out of pocket. And what this simply means, if you have, let's say, a surgery and the surgeon's approved for a $5,000 surgery and they were to add 15%, that means that extra $750 would be paid by you because you had a plan that did not cover that. All right. And then in addition, N has a couple small copays. Every time we see a doctor, we are subject to a $20 copay. Now, it can be no more than 20, but sometimes it's 18 or 16. But the point is they can't charge any more than a $20 copay depending upon the service that you receive from that doctor. And then if we go to the emergency room and we're not admitted to the hospital, then we'd be responsible for a $50 copay. All right, so that's the N plan. All right, now I'm going to show you some prices now as we look at these different companies. And again, there's multiple companies. We're just highlighting in this video Cigna and Humana, but let's look first at the G. Now, what you're going to notice here, I'm actually looking at G and N rates from the area around our home office. We're actually in the Kansas City, Missouri, Overland Park, Kansas area. So these are representative of that particular market. So rates are going to vary. So these are kind of average. Some states are going to be a little higher, some a little bit lower. But the point, I'm just trying to teach you kind of the things that we're looking at when we look at different companies. All right. So when we look at someone that is going to go on Medicare, and these rates are for someone that's going on Medicare initially at 65. And most states are going to have male rates and female rates. And so you'll see the female rates a little bit lower than the male. So if I'm going to go with Cigna in this particular market here, what we have on the G plan, you can see a male rate is $141.36 a month. Now, this is a husband and wife going on a plan. They are having these rates included what we call a household discount. They both went with the same plan, which is, of course, very common as well. You can see the ladies about $15 a month cheaper. Okay, that's Cigna. And then we look at Humana. Humana is going to be very competitive. Of course, you can see they're going to be at $143.80 for the man G, and the lady who chose a G is going to be at $125. Okay, so again, both these carriers are very competitive. And again, I want you to know, I'm not promoting them in this market. I'm just simply saying if you were to go with Cigna or Humana, this would be the rates presently for the G plan. Now, the N plan, again, is going to be lower. Well, why is that? You can see here the difference in premium is going to be about $40 a month range. And so why is that? Well, because you as the insured are willing to take on a little bit more risk, the excess charges, and the possibility of some copays whenever you go to the doctor or had to go to the emergency room. And you can see 98 versus 88, so about $10 difference between male and female with Cigna. And then Humana, again, very competitive here, $99.56, and again, $10 less for a lady if she were to go with the N plan. All right, and so when we look at carriers, we care about the initial rates, and that's what we're talking about here, but we also care about the stability of the rates. So if you decide you want to work with us, what we'll do, look back and look at the history of rate increases with these companies in the last 10 years, because we know all these are going to go up, but we want to go with a carrier that is proven to be very, very stable. All right, and so that would be Cigna and Humana. Now what we're going to do is we're going to look actually at the Advantage plan. So that's the one system going with the Supplemental plan. Now let's look at these two companies' Advantage plans. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us the thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. Now before we get into the details of these plans, just a quick reminder, when I'm taking an Advantage plan, I'm enrolled in A and B. Again, A is usually a zero premium as long as we have 40 quarters paid into Medicare tax system, but the B does have a premium. This year it's $174.70 a month for most people. And so when we are on the Advantage plan, we're paying the B premium. So what we're going to look at now is Humana and Cigna. Again, in this particular market here, there's about 45 different plans that are available. So we just selected these two to make this comparison. Again, these would be very reputable companies as well as very good plans. So let's look at Humana and Cigna. Both of these plans are PPOs. Now, I purposely selected PPOs because PPOs are going to usually have some broader benefits. They're also going to give you a broader network. HMOs, we have fewer doctors and fewer hospitals that are available. It doesn't mean HMOs are bad, but the point is a lot of people are concerned that they have to stay in their network on an HMO. Many times HMOs require you to have a referral from your primary before you can see a specialist. A lot of people are annoyed by that, and so that's why the majority of people will pick PPO plans. So that's why I've chosen this for this particular video. Again, Humana, you'll notice here, this is a Humana choice. Cigna is also called True Choice. Both PPO plans, both allow you to go out of the network. And you're going to notice, first off, that both of these plans have zero premium. Now, we've paid Medicare, of course, but no cost for the plan because now we're going to pay as we go for different services. So you're going to see here, first off, deductible, which means would you have to pay a deductible before the plan pays, and you can see both of these zero deductible. You immediately are going to get coverage. One of the real important parts of any Advantage plan is to look at what the max out-of-pocket is. As you can see, these both very similar. Humana 36, Cigna 3700, so very close there, but this simply means that you would never have to pay anything beyond that if you stay within their network. So if you had a bill that's $100,000, you're not going to pay that. You would max out at these particular dollar amounts. And again, this would be the in-network maxing out. Now you can see both of them do not charge anything for you to see your primary care physician. Now you'll notice here Cigna is saying if you go out of the network, it would cost you a 40% copay. Just so you know, Humana is the same, but they share that a little bit later in this report, but they really are identical here. And so again, if I stay in network, zero to see my primary care physician. And of course, that's why when we write Advantage plans, we're always making sure that we know who your docs and specialists are so you can find network providers. Okay, so specialist visit. Now we're talking your cardiologist, a dermatologist, orthopedic doctor, OBGYN doctor. And you can see very close, Humana $5 cheaper than Cigna, 30 versus 35. And then skilled nursing facility. Now watch this. We're noticing here that in network, the first 20 days in skilled nursing cost you only a $20 copay. Remember, in original Medicare with the supplemental plan didn't cost you anything. That was covered by Medicare. And then after that, we have a $203 a day copay for the next 80 days. And that would be the responsibility, of course, with original Medicare as well, but we could, have the supplemental plan pay that. So here, we're always going to be participating in some of the cost of our skilled nursing stay. And again, a reminder for this is after a stroke, hip replacement, those kinds of things where we need fairly intensive rehab. Home health care, this would be after like a knee replacement, you go home, zero copay on both. Now, as we look at outpatient mental health, both of these, of course, have very good coverage, but you're going to notice Cigna actually has a zero copay for psychiatric care, whether it's individual or group, as long as the provider's in network. Humana is going to be at a $30 copay per session. Emergency room visit. Now keep this in mind as we see this copay visit. This is waived if you go to the hospital. So within 24 hours after seeing the ER, if you have to be hospitalized, then both of these companies will waive that particular copay. Okay, so the inpatient stay, a little difference here. You're noticing both the amounts the same, but the days are different. So we have $295 a day by Humana, $295 a day by Cigna. Now let's pause for a second and talk about that $295. Hey, if you come to a place where you know you're going to have to make some Medicare decisions pretty soon, the best way to do that is to click up here in this right-hand corner, and you'll have an opportunity to be able to book a call with one of our Medicare guides. All the guides around here I have personally trained, and they truly are professional. They'll answer your questions, and they'll show you different Medicare options to make sure that you're confident in the decision that you make. If I'm on an Advantage plan, I have a daily copay in the hospital, as they all do. That covers everything I receive of services that day. I could have, 4 doctors come and see me. I could have 2 MRIs and 3 CAT scans, or I could have a surgery. And the point is, no matter what I have done that day, whether it's a lot of service or little services, I pay the same amount because that daily copay covers every doctor, and even a surgeon. Everything that goes on that day is covered by the daily copay. Now you'll notice that Humana, their max is 5 days. So if I'm in 5 days, it costs me $295. Cigna is 6 days, so it'd be 1 extra day out of pocket on the Cigna plan. And then after that, each of these, once you've met the max, there's zero for the next 90 days. Now, if I'm in the hospital 6 months later, I'm going to have to do this again. So each hospitalization, we're going to be responsible for the daily copay. All right, so Part B give back, that means they've reduced the Part B premium. There's very few plans to do that. Some do. These do not, meaning you're paying your full Part B premium this year, $174.70 a month. All right, both of them have very good prescription drug coverage. You're going to see here, hopefully you can see kind of in the fine print, Humana, your preferred generics on both are 0. We would call these like a tier 1 medication, just your tier 2 regular generics, 5 versus 4. Preferred brand names, 47 versus 45. And again, very, very similar here when it comes to your medications. Let's scroll down here. And what I want to do next is I actually want to talk about some of the more details of these plans. So I can't compare them side by side. I'm going to talk about each of those, but let's look at some of the other details with the Humana plan that I think you'll find to be interesting and possibly useful as well. All right. So when we have Advantage plan, we also have some additional services that the plans cover. And you're going to notice here an ambulance ride. This means, to the hospital. The Humana plan here is $300 copay per trip. And then look at this perk here on the over-the-counter items. They have a $40 benefit coverage amount every 3 months. And it says the unused amount roll over to the next 3 months. So what this means, they set aside $40 every 3 months that you can use to buy over-the-counter items. Could be, aspirin or Tylenol or supplements, different things they make available online or through their catalog. And so this would be a benefit of $160 a year. And you can see that's going to carry over from quarter to quarter. But this is something you certainly would want to take advantage of. Humana does cover chiropractic. If you go to an in-network provider, you'd have a $20 copay. Podiatrist, $30 copay. And then look at when it comes to oral exams, this would be the dental portion here. You can go at 0 copay to a network provider. But look at the eyeglasses, eyewear here. We have lens and frames. If you stay in network, there's 0 copay. You can get one preventive eye exam once a year at a 0 copay. Look at the hearing aid benefit here. It varies depending upon the type of hearing aid that you pick out, but $3.99 to $69 on copay. And normally they provide this per ear per year for the hearing aids. So you get a hearing exam as well. We've already talked about psychiatric care, $30 copay. Okay, and so look at this benefit down here called the spending account card. Now this is called Flex Allowance. You receive $500 a year to use toward the plan's covered dental, vision, and hearing services. So again, just an additional $500 in benefit that Humana puts on the table for you to take advantage of. And then of course, fitness benefit, like most of them are going to give you a membership at Silver Sneakers to be able to work out. If your gym or community center takes that, then there'd be no cost for you to be able to work out at that particular facility. Now remember I said earlier that Humana wasn't listing the out-of-network costs, but we know there is if we go outside of the network. Again, it's a PPO, so it's going to be large, but if you go out, you're going to notice here about 50% co-insurance. Remember, Cigna was about 40%, and then what they do is they combine the in- and out-of-network maximum, because remember, this plan had a max of $3,600, but if I go out, it bumps to $5,750. So it's not $3,600 plus $5,750. It'd be combined in and out network for max out of pocket. All right, so that's the details on Humana. Now let's go back and let's look quickly at the same details when it comes to the Cigna plan. All right. And again, we're going to scroll down here and start again right around the ambulance benefit, because then we'll pick up some of the other details about this plan. All right, so we have the ambulance the ground is $210. Look at your air ambulance, 20% co-insurance. Now remember, it's probably expensive, but we have that max out of pocket, which as long as it's going to be a network, was on this plan was only $3,700. But remember, Humana was $300 flat, whether it's air or ground. Again, not a real big deal, but a little difference here. Now notice what happens over the counter for Cigna's $65 every 3 months, but they don't indicate that it continues to roll over if unused. So you probably got to use it every 3 months or you would lose that. Their chiropractor is $15, where Humana was $20. Podiatry was $35. And then psychiatric was $0. Remember, Humana had a small copay for that. And then Part B give back, remember when they reduce your Social Security check, again, this particular plan does not offer that either. And then we see urgent care, and then we see hearing services. Here we go, let's talk about this one. So we can get a hearing exam for $25, and then their hearing aids, very similar. But notice it's every 2-year benefit, not every year, like it was on the Humana plan. And you can see the cost sharing. Copay was $399 to $1,800. You remember Humana was $399 to $699. This tells me probably Cigna has some very nice hearing aids available as well if you're going to have that kind of a high copay. That's why they're so expensive on that particular one. Again, it's always wise to go in network on these kinds of services. So vision, again, one routine eye exam, zero. $35 would probably mean if you went to a specialist instead of a primary care for that. Now notice what they're doing here. They're going to set a maximum for your eyewear of $250 a year. So they kind of lock that in. If you stay in network, then they'll spend $250 for eyewear, which would be glasses, lenses, frames, as well as contact lens. Okay, and then dental services, it says here they will give you $1,700 of dental benefit. With that Humana plan, remember they gave you preventive, and so if you're going to get other dental service, you'd actually have to buy a dental plan that they made available. Very affordable, but again, this is included at no cost on the Cigna plan up to $1,700. Now the key here is to find a dentist that's going to take the plan, and you certainly should be able to do that. All right, and so fitness benefits, same thing. They're going to offer their network is called Silver and Fit instead of Silver Sneakers. Again, Silver and Fit probably not as large of a network, but still a very a good network as well. All right. Okay, and so we have telehealth as well, so different things that they're going to offer here. And then remember, Humana had that card, Flex card. Cigna calls it the Healthy Today. And so this says it's a pre-loaded benefit card where you have over-the-counter allowance at $65 every month. So you can use that, of course, for items that they're going to list in their catalog. And again, these over-the-counter type items would be available. Okay. So as we kind of sum this up, again, similar plans, little variables between the plans for sure. Both very good companies, both very good networks. And so we just want to make sure that anytime we enroll into an advanced plan, we take the time to look at the details of these plans to make sure that you've made the right choice for your particular situation.